What you see in our thumbnail? It is filariasis. It is not caused by microorganisms like bacteria, virus, fungi. It is caused by one animal. Yes, it is comes under the Animalia kingdom, roundworms. Myself Sukumiii, I am the student of occupational therapy. These roundworms are spread by blood-feeding flies, black flies, and mosquitoes. There are 120 million filarial cases in 80 countries, and 1 billion people are at risk of filariasis. 90% of filariasis comes due to the organism called Wuchereria bankrafti, and remaining 10% are caused by Brugia malayi. These two organisms can live for only 5 to 7 years, but in this period it can produce millions of offspring. What the organism doing in our body? It blocks the lymphatic system collecting useless fluid from tissues. If it blocked, the tissues are the tissues cause edema. Accumulation of fluid in the tissue is called edema. In Africa, Anopheles categories, Anopheles species are act as a vector. In Pacific and Asia side, the Aedes and Mansonia act as a vector for this filariasis. Lymphatic filariasis is endemic in some countries. What is endemic? Is a disease caused in a localized area. In particular territory is called endemic. What is epidemic? If the disease caused worldwide, then it is called epidemic. So lymphatic filariasis is endemic, which means it particularly affecting the area. I already said filaria is not a bacteria, fungi, or any other microorganism. It is an animal kingdom category, but it is microfilaria. So which means round worms are there, but it can't be seen by naked eye. So we have to use microscope to view the roundworms. What is the life cycle of Wuchereria bankrafti and Brugia malayi? First, the mosquito is a vector, so it going to be inject the organism. So the injective organism is a juvenile organism. It is not an adult Wuchereria bankrafti or Brugia malayi. It is a juvenile organism. Now the juvenile organism going to enter into the lymph nodes, and it causes blocking of the lymph fluid, and it starts maturing. So it attains the sexual maturity, and it going to be separated as a male and female organisms normally producing the microfilarias. So these microfilarias are again carried out by the vector. Another mosquito is biting the person, so it carries the vector. So it acts as a vector and carries the organism to the another person, and that juvenile organism is continues to grow in their lymph nodes, and it flowing in the blood stream. So in blood, the mosquito take the organism and it acts as a vector. So the person with filariasis have suffered from lymphedema, elephantiasis, and swelling of scrotum. It is called hydrocele. This is what you read in thumbnail. Do you know lymphatic filariasis can cause permanent disability to the person? So worldwide, it is the major organism that causes the major disability to the worldwide people. I want to say another thing. The female organism produces the microfilaria and it goes to the bloodstream. But the female organism is still in the lymph nodes and it causes some symptoms to the person for 7 years. So I already said the lifespan of the Wuchereria bankrafti is about 7 years. So it still live, but it also produced a microfilaria. So I already said it can produce the billions of new offsprings. So it producing, and also it causes the disease to the person by sitting on the lymph nodes. And it only produce the offsprings to the bloodstream, not to the lymph nodes itself. So the produced microfilaria are have to going to the mosquito. So in mosquito they can live for 2 weeks and it develops as a larva and only it comes into the human body. So if the cycle is interrupted anywhere, so if the mosquito can't sustain the organism for 2 weeks, means the disease is not going to be produced. So the process is stopped. So if the cycle is correctly maintained, then the disease come to the humans. I already said the organisms are living in the lymph nodes. So due to this, lymphatic dysfunctions are going to be the symptoms. Inflammation in the lymph nodes, and there is a immune reaction so to the worm and the worm products. So it may be living worm or the dead worms, or it having some products, the worm products. What are all the recognizable manifestation in this filariasis? I already said lymphedema and elephantiasis. What is elephantiasis? In this thickening of skin is present due to the accumulation of the worm. So worms are heavy weighted, right? So the skins are hardened and our body is totally hardened. So it causes the elephantiasis, and then swelling of the scrotum. It is called hydrocele. In elephantiasis, we can simply remember the swelling of the limbs are present and swelling of the genitalia is present. So for both male and female. Some person may have symptoms like fever and kidney failure and skin abnormalities are all. So the filariasis affect the person socially. What are the social impacts due to the filariasis? First, sexual disability. They can't produce their own offsprings and they never ever encouraged by the society because their signs and symptoms are projected outside. So they may have the chances to regulated in the society and regulated in family, and in some areas they are working, those areas they don't have the capability to work like normal person. They lack their working abilities. How we diagnose the Neisseria bankruptcy and Brugia malayi? So we are using the blood culture. So we take out our blood and we are using microscope and we are looking for the roundworms, filaria. So some organisms can hide their appearance in particular period. So we have to check for twice or thrice. So it may have the chances to hide their appearance. So it has that ability, the organisms. These organisms can only show their appearance in microscope also midnight time only. So at least for 2 or 3 hours only it shows their appearance. Other time they hide their appearance and they live like a monster. Now ultrasounds also can diagnose the movement of the roundworms, and new COT tests are available. So it can diagnose the roundworms at any time. So improving in the diagnosis field. What is the treatment? Before treating the affected person, we have to stop the transmission of the organism from the affected person. So we have to kill the microfilaria produced in the person, able to transfer from the mosquito. So we have to kill the microfilaria first, then we have to treat for the lymphatic nodes and the organisms found in the lymphatic nodes. Drugs like ivermectin and albendazole, so they are have some side effects, but it treating the infection particularly. So even side effects like fever, headache, some of the side effects also present. So to avoid elephantiasis, we have to protect our limbs from the any other bacteria or any other organism. So we have to wash the affected part regularly and we have to little exercise to the affected part. So if this limb is going to be the elephantiasis, we have to work in this limb. So the muscle spasms are also decreased when we doing exercise. We can drain the limbs artificially. Lymphatic drainage we can do, and we can also do the anti-filarial drugs. We can take the drugs and we can reduce the symptoms. So for us, that are not matter. Prevention is better than cure. So how we can prevent the filariasis? Notice one thing: we can't control the protection of the mosquito. We can't control the protection of the filaria organism. We can only control ourselves from the contact with the vector, which means we don't contact with mosquito or black flies, so that are injecting. So reduce the mosquito protection in our living area, which means this is a house, we have to prevent the mosquitoes in our area at least. So we can't reduce the mosquito protection in the forest, but we can reduce the protection of the mosquito in our locality. Remember, that is only way we have to protect ourselves from the mosquito. It's the only prevention method. We can use nets during sleeping, and we can use full hand sleeves like this. So during going outside and during in home also. So in particularly in winter season. So in this season the mosquitoes are produced more and more. So we can prevent only by getting out of the mosquitoes only, controlled by the government also. Okay guys, in our video we will see what is filariasis, and how it affects and how can we prevent from getting the filariasis. So please subscribe. I also want motivation. So encourage always. So think positive. Thanks for watching. To reduce the endemic lymphatic filariasis, the many programs are implemented and controlling of the mosquitoes are